So a TAE stands for a transarterial elbow embolization. This is for people who have chronic tennis elbow or golfer's elbow. Tennis elbow is when you have pain kind of more on the outside of the elbow, and it's very common with playing tennis and everyday activities like scrolling with a mouse, or people who work with their hands a lot or working on a keyboard. And it's just the tendon on the outside of the elbow. And then golfer's elbow is the other side. It's a little bit less common. But tennis elbow is an extremely common condition. And in many cases, when people get it, it will go away on its own if you give it time. But there's going to be a decent amount of people where that does not happen. And there's not a ton of options available. People can take NSAIDs, medications like ibuprofen, Aleve, Tylenol. People can also try to take a break from whatever it is that they're doing. Stretching exercises can be done. Rehabilitation, but the results are kind of variable. For the most part, people would try things like steroid injections, but it's really not a great technique for that pathology because it could actually trigger long-term further degeneration. And also if you get any improvement, it's very temporary. The transarterial elbow embolization, it's a relatively new procedure that recent data has proven to be extremely favorable. It's thought to be at least as effective as surgery. With a essentially 90% effectiveness rate. The procedure itself is also very quick. It should only take an hour or less to do the procedure. The procedure can be done with somebody wide awake or with just conscious sedation. We make a puncture in the wrist right at the radial artery, and then we feed a catheter up to the elbow area. We take pictures to diagnose the pathology, and then if we see it, then we can go ahead and treat it. The way we treat it, we just inject a very small amount of medication that will essentially kill off little vessels that are causing the pathology. We use something that we call temporary embolic medication, meaning that it's only designed to really kill off small pathological vessels with essentially minimal to no risk of it getting into a vessel that you don't want it to get to. So it's one of the few techniques or procedures or treatments for tennis elbow that I'm aware of that actually can reduce pain, reduce inflammation, and actually be potentially curative by actually helping to reduce and eliminate the pathology that's present.